the first new initiative, we've given the name the Past Antibody COVID-19 Community Survey, or PACS, P-A-C-C-S. The word past in the title refers to the goal of this project, which is not to understand how many people are infected right now, but to understand cumulatively how many people have been infected since the start of the epidemic. And we do that by using a type of testing called antibody testing. So different from the type of testing that detects the presence of virus in a swab collected from the nose or the throat, antibodies are a blood test which measure the body's response to the infection at some point in the past. So the benefit of using an antibody test is that they tend to stay positive for a longer period of time. So if we do this in a strategic way, we can understand what has been the burden over this first 6 months of the epidemic. So the way that we're going to approach this is through a partnership between DHS and the University of Wisconsin School of Medicine and Public Health, who operates an ongoing study called the Survey of the Health of Wisconsin, or the SHOW, in an additional partnership with the Wisconsin State Laboratory of Hygiene, which will be conducting the antibody tests. The goal will be to recruit volunteers in 10 counties around Wisconsin, using the infrastructure that the SHOW study has established through previous research over the past 10 years. Volunteers will provide a blood sample, which will be tested for antibodies, and then in an anonymous way, we will analyze these specimens to know how many people have been infected cumulatively in strategic areas of the state. The testing will be performed at the State Lab of Hygiene starting in June, and we will do subsequent waves for a year, every 3 to 4 months, to understand how has the epidemic changed over time. The study doesn't provide information about current positive cases. It's not an alternative to diagnostic testing. In fact, participants in this survey will be screened for symptoms, and if they have any symptoms suggestive of COVID-19, they will actually be directed to a diagnostic test, a molecular test, to see if they're infected now. The idea here, again, is to understand how broadly has the epidemic spread during the first 6 months of the epidemic, which will give us some better information to understand how to prepare for the future and to know what communities have been harder hit as we continue to learn more about this.